It's Patrick Hutzel from IntensiveCareHotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question in this series of questions from my client Veronica. And the question last week was part 2 of my 71-year-old dad is in intensive care with stage 4 lung cancer and stroke. He's on the ventilator now and in an induced coma. What are his chances of survival? You can check out last week's episode by clicking on the link below this video. In today's episode of Your Questions Answered, I want to answer the next question from my client Veronica, which are excerpts from phone and email counseling and consulting sessions with me. And the question this week is, my 71-year-old dad is in intensive care with stage 4 lung cancer and stroke. He's on the ventilator now and in an induced coma. What are his chances of survival? And again, that's part 3 in today's episode. So Veronica continues with her dad's situation below as follows. So Veronica writes, "Hi Patrick, my dad is so precious to me and I want to know I'm doing everything I can to help him recover if possible. And to know everything possible is being done to help him whatever the outcome, I need your reassurance he was cared for and given every chance to try and recover. My dad is a strong man, mentally and physically. He was extremely active even a few days before being admitted to hospital, and he deserves the best care possible. I'm off to the hospital this morning and I hope to get more information and dad's blood results, his chest x-ray, and arterial blood gases and ventilation settings. If you get this email, please send the list of what else I need to find out. Thank you so much, from Veronica." So here is my response. Hi Veronica, it's good to know that you have spoken to the cardiologist as well and got his views as you told me yesterday. It's also good to know that your dad is on propofol and not on midazolam. Even though I believe an angiogram would be good for clarity what's happened with your dad's heart, the heparin he's getting would be prohibitive for an angiogram as he's at high risk of bleeding with the heparin going in. If troponin levels are within normal range, it minimizes the risk that your dad sustained a heart attack indeed. It might well be a stress cardiomyopathy. Hopefully that's the case and the heart will go back to normal. If your dad aspirated, as you've hinted yesterday in our phone conversation, you should be asking for his chest x-ray results and again arterial blood gases. I can help you interpret all of the information and how it impacts on your dad's overall situation. It's definitely a good sign that your dad is responding to you, especially with a stroke from last week. I see this as a very good sign. There are a number of things you should get updated on daily, just as we discussed yesterday. I will give you a whole list of updates you should be getting daily soon. It would also be good to know what ventilation setting your dad is on. So, when you go to the hospital, the following is important. Again, what sedation and how much sedation he's on, because that might change on a day-by-day basis. Find out your dad's ventilation settings and what is their plan with ventilation going forward. Are they trying to wean your dad off the ventilator and get him out of the induced coma? Again, get chest x-ray results. Also, blood results, especially infection markers such as white cell count, but also hemoglobin, platelet count, and neutrophils. Also, find out if your dad is still on inotropes such as the noradrenaline or norepinephrine. Also, what is his neurological response? That means, is he still responding, especially in light of the stroke from last week? In fact, find out what his Glasgow Coma Scale, also known as GCS, is, and I will talk you through it, what it means when we're back on the phone. Also, Is his skin intact? Especially when being bedbound and immobile, they need to manage his pressure area care. Also, is he in a regular or irregular heart rhythm? Again, with the ejection fraction low, around 35%, there is a bigger risk of the heart beating irregularly, such as atrial fibrillation, also known as AF. And if he has AF, that would also increase the risk for a stroke. Also, keep asking what his blood clotting is doing in light of the heparin he's getting. Again, this is often stroke prevention therapy to keep the blood thin, but it shouldn't be too thin. And the marker you need to ask for is APTT. Also, here are arterial blood gas parameters. So normal levels are for oxygen, also known as PaO2, is 75 to 100 millimeter per mercury, or 10.5 to 13.5 kilopascal. For the carbon dioxide, also known as PaCO2, it's 38 to 42 millimeter per mercury, or 5.1 to 5.6 kilopascal. Arterial blood pH should be between 7.38 to 7.42, and oxygen saturation between 94 to 100%. I hope this helps. And also other results they are getting from an arterial blood gas are hemoglobin, potassium, and lactate. So hemoglobin should be above 70 or 80. Potassium should be between 3.5 to 4.5, and lactate should be ideally less than 1. Those results are not as important, but they still give you some indication of what else might be going on. I hope this helps for now. Please let me know if you have any questions. And it is the most important stuff you need to know for now. Looking forward to you calling me tomorrow where we can discuss further. So, and if you are watching this and you want one-on-one counseling and consulting and advocacy with me, go and check out the options on the top of the website where it says one-on-one counseling, and select from the options that work best for you, and I'll talk to you then. So here is Veronica writing back. So Veronica writes, "Hi Patrick, here are Dad's blood results and other levels. Oxygen from the ventilator is 45%. Carbon dioxide is 32 to 35 millimeter per mercury. Arterial pH is 7.42 and oxygen saturation is 100%. Hemoglobin is 106, potassium is normal, and lactate is down now. It was slightly higher yesterday." The nurse looking after Dad said they still can't print any reports as their IT is trying to fix their printers at the moment. I didn't go back in as they cannot give me copies until it's fixed. She said she will try to email the scan report to me. Thank you, from Veronica. And here is my response. Hi Veronica, thank you for sending those results through. The numbers look really good. I would still be interested to know his PO2 level. PO2 level is the oxygen level in the arterial blood gas and may actually vary from the oxygen saturation. Especially with the oxygen from the ventilator still at 45%, 45% oxygen level is still too high. For example, in order to wean your dad off the ventilator, he needs to be on less than 35% of oxygen, also known as FiO2 from the ventilator. The PO2 level actually determines if oxygen on the ventilator needs to be reduced or increased. Also, with significant lung disease, carbon dioxide or PCO2 levels can be increased as well, and they look normal, which is good. I would also be curious to know what other ventilator settings he's on. Other parameters you may be asking for is PEEP and pressure support. It would also be good to know if he's doing some of the breathing himself or if the machine is doing most of the work. Also, have a look at another article video here so you can determine if they're doing all the right things to get your dad off the ventilator. And the article is how to wean a critically ill patient in intensive care off the ventilator and the breathing tube, and you find all the information that's relevant for your dad's situation in there. And you can find this article and video if you're clicking on the link below this video in the written version of this blog. So if for whatever reason they can't wean your father off the ventilator and the breathing tube, they may consider a tracheostomy in consultation with you, your mum, and your father if he's getting more awake. Have a look here to find out more about how long his breathing tube, also known as endotracheal tube, should stay in, and whether he should or shouldn't have a tracheostomy if they can't wean him off the ventilator. So you might want to look at the following articles and videos. How long should a patient be on a ventilator before having a tracheostomy? Or how long can a breathing tube or an endotracheal tube stay in? The next article and video that's relevant for your dad's situation is, why would a critically ill patient in an induced coma need a tracheostomy in intensive care? And last but not least, what are the risks and benefits of a tracheostomy? Going back to the blood results you sent through, the overall numbers including his hemoglobin look pretty good. There is no reason at this stage for doom and gloom. A high lactate level can actually indicate an infection as well, and it's normal. That's a rather good sign. We're going to talk again tomorrow over the phone, and we can go into more detail then, especially with a view of a tracheostomy. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language, so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what is really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again in another update next week. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions, or you can call me. Find international phone numbers on our contacts tab. Also, Check out our ebook section where you get more ebooks, videos, and audio recordings, and where you can also get one-on-one counseling and consulting with me via Skype over the phone or via email by clicking on the products tab on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.